Good afternoon, everyone. I will for sure finish 2 slides in 2 minutes. Okay, so I'm going to talk about the antiretroviral therapy among US Medicare enrollees with HIV. So since 2012, people with HIV in US, they need to get on ART regardless of their CD4 count. However, there are very limited data from real practice how this implementation for this guideline has been done. So we would like to use US Medicare data for those people with, or all people with HIV between 2007 and 2019 to look at the ART prescription rate over year and also by subgroups. Actually, we found out that the ART prescription rate is increasing over time, and but the rate is quite different by different group. So we can see the older people and female, they receive ART as well as those qualify for Medicare because of old age. And this slide shows, we identified a set of chronic conditions actually associated with low prescription of ART. So this already adjusts all kind of demographic variables. This is using the 2019 data. There are also other factors associated with the low ART. And our conclusion is that people with HIV, they are getting ART, like the prescription rate increases over time, but the disparity still exists. Older people get less ART, and the females as well, and the chronic condition matters. More depth research is needed. We need to investigate how this is driving the factor for this disparity. I welcome any feedback, any insights, and we definitely need to do more. Thank you.